I'm Amy Price.
Today's date is the 25th of August.
Hello, this is Tom Wilson with Week 5 of Stanford's Medicine X ELP program video update.
Hello, this video is for Week 4 and it's about an ideal visit.
I am a doctoral student in the School of Nursing at UCLA, and I'm actually on my honeymoon. Beautiful white lady.
As a patient myself, I always think that it's very important to include the patients themselves in the decision-making process.
We really discussed his interaction with finding a solution for a problem that he had. He was homebound for 15 years. He saw a plethora amount of doctors and physicians to find a cure for his illness.
We got to talking and we were a lot more alike than I would have guessed. You know, he's an entrepreneur and setting up a business and getting an advanced degree in technology. And I am a patient who spent 11 years homebound with a mysterious illness until I figured out what was wrong and eventually developed the surgery to fix me.
This week we talked about the ideal anatomy of a healthcare visit. One thing that kept coming up over and over and over was communication. Communication is key. Communication and transparency build the foundation of trust.
The most important part of a healthcare visit, of any interaction with any practitioner, is having everyone in the room respected and on the same page. I've had doctors come in and just talk down to me and just be super rude and act like I have no idea what's going on. Our biggest thing about what we both agreed that was important for practitioners to do is to really take the time and get to understand and get to know the patient and understand where they're coming from.
We talked about how empathy could maybe be taught somehow in medical school, and patient stories and videos could be shown to medical students because it has a much more impactful way than just teachers telling them about empathy.
A lot of it is feeling valued as a person. You know, when a patient is in the waiting room for 40 minutes, 50 minutes, not knowing when they might see the doctor next, that isn't the best system to make someone feel that we value their time.
The doctors would talk to her family members or her husband and not really address her as if she were a child. And I can understand that being a frustration because she's not a child, she's a grown woman, she's very well educated, so why would people kind of talk around her and not directly to her?
Because what always comes out is that life is full of change and uncertainty. And so it's not so much about the end result as it is how we make that journey count for one another.
If everyone included were to be used as a checklist of care, to say, okay, we are all equal partners in this, but it really has the potential to change quality of care. That being said, Shari and I had a chance to really talk about what it means for everyone to be included, because everyone included in medical care also includes pharmaceutical companies. Does it include insurance companies? Does it include sort of the corporate aspects of medicine?
I do think it might be difficult to implement though. I feel like the doctors are socialized to take the credit for the healing that happens within individuals, and so I think it might be difficult for them to relinquish this power.
Wrapping things up, talking about how supporting each other is one of the most important things that we can do, how vital that is for a cohesive healthcare experience.
Shamia and I found that no matter how tired we were when we started to talk together and share ideas, we were fired up and enthusiastic about the changes we could make, not in changing healthcare, but in redesigning it, on building on what people had already done well, and suggesting some tweaks here and there. So this is it for Amy Price. Thanks so much, and goodbye.
Thank you.